My name is David. I was born here in Miami, born and raised here, went to school up in Ohio, came down here, became a teacher, taught for 38 years, retired when I was 59. I play softball, I play golf, I play basketball, so I try to stay active. I work out a lot at the gym. I found out when I visited Cleveland, Ohio, that they were going to have the senior nationals. So I thought, I wonder if I'm any good. And then went up to Cleveland. And of course, this is the story of my beginning career because I pulled a hamstring about a week before the meet. In the 4 years before 2017, pulled my hamstring about 3 or 4 times in the summer and couldn't compete. Went to the senior decathlon in 2017. Won it. Finished off that year and made All-American in 5 events. And then all of a sudden in 2018, in January, my knee said, you know what, you're not doing this anymore.
Mr. Haas is a very interesting case. He exercises 5 times a week and he is involved in track and field, even at his advanced age. He came to my clinic for evaluation of bilateral knees. He has been experiencing debilitating pain and restriction of motion over the past 3 years.
Competing or not, I was constantly in pain just walking. Anything where I had to bend my knee would hurt.
For Mr. Host, his short-term goals was to regain his range of motion and decrease his pain. His long-term goals is to get back to the big stage and compete at the senior Olympic level.
They just x-rayed my knees and came back and said, yeah, you don't have a cushion in there and you have bone hitting bone. What happens when you're bending your leg? It's hurting, so you can only go so far.
After we agree on proceeding with modifications of exercise activities, continuation of stretching exercise, and intra-articular corticosteroid injection, which in his case was Kenalog, provided significant relief to his symptoms.
They gave me a shot, I guess, that afternoon. And I knew that evening it was already working. It was like, wow, is this what it's like not to feel pain? Because it felt great. A week later, I went out and said, you know what, I wonder if I can compete. By my 3rd jump, I'd already done a foot further than I had at state. I already would have made All-American, would have won the meet if I jumped. And it felt that good. It didn't hurt one bit, and it was like I was gliding. And I thought, wow, this is fantastic.
Patient came to see me 6 weeks later, and he had improved 90%. His pain was none, and his range of motion on his right knee improved from 110 to 130 degrees, just like his left knee.
I can actually put a shoe on like this. I couldn't, if I'm on camera, I couldn't bring this foot up here to put a sock on or a shoe on.
Miami Orthopedic and Sports Medicine Institute has a long reputation along with great surgeons and providers who have been taking care of our community and professional teams through many decades. As a provider, it's an honor and great satisfaction to be able to provide patients with care and being able to get them back into a good quality of life and get them back into their level of activities.
I went 3 years thinking I can do it myself. I don't need to go to a doctor, I don't need to have anything done, and I couldn't, and I was in pain for 3 years. And I look back now and I go, what a difference. And I guess I should have gone in earlier. So.